At my diabetes clinic that I ran for years, I could lower people's numbers 2 points with pharmaceuticals, but eventually I learned if you want to actually get them off of these medications or actually resolve the problem, they're not going to do it without a dietary change and without implementing lifestyle measures and getting to the root, stop causing the toxicity that caused the problem to begin with. So if you are on numerous medications or you're on certain class of medications and you're knowing that you should get off of them, I'm the one you need to come see at Nutrition World. If you're on medications like long-term NSAIDs, you're on proton pump inhibitors, benzodiazepines, if you're on statin drugs, other cholesterol medications and heart drugs, there's a lot of them out there that long-term use has been shown to be a problem. I'm Dr. Curt Deering, and I've been a clinical pharmacist for over 3 decades. I graduated from Mercer University, and I worked initially at Grady Health System in Atlanta. I created clinical pharmacy services there. I started with the dyslipidemia clinic and a medication therapy management clinic, and then I moved back to Chattanooga in '97, and I worked at Erlanger for 25 years doing diabetes clinic, anticoagulation clinic, and several other specialty clinics. And as time moved on, I started realizing that our medical field is sort of focused in on strictly pharmaceuticals, and as a clinical pharmacist, of course, that's my specialty, is to know which medications fit which disease state, and I sort of was limited though in just pharmaceuticals. And it wasn't until I had a family member that needed help in other areas, and I realized that the pharmaceutical world had no solutions. And that's the first I learned when I reached out to find answers, that what, lo and behold, the nutraceutical world had answers. And so I started using them, they worked, and I started thinking, well, what other areas do these things work in? And then in my personal life, started using more and more supplements and saw that they work, and you don't have the toxicities and the side effects that you have with the pharmaceuticals. So I just slowly made a transition over into believing more and more into the nutraceuticals, realizing that we had a whole educational system that's set up in the medical field to sort of talk about pharmaceuticals only and to not reach out into a more of a holistic approach. What I bring to the table is that I know the good, the bad, and the ugly of the pharmacy world, but the kind of patients that I'm most beneficial for, or the kind of clients I'm most helpful for, are people that are coming in. They're sort of polypharmacy, they're on too many medications. A lot of these are your metabolic disease type disease states of diabetes and heart disease and high blood pressure. And these are the patients I'm finding are coming to the most and saying, I'm on these 10 different medications. How can I limit the numbers of medications that I'm on? I do have ones that I consider good in the pharmacy world, and those are the ones that I'll let you know, this is doing you good and we need to stick with it. And there's ones that aren't so good that I can find better alternatives for, and then there's some that I just strictly say, we've got to get you off of this. And those are the ones that, and I'm finding great alternatives in the nutraceutical world. What are these medications? I think people mostly know. If you're taking NSAIDs all the time, it's not a good thing. If you're taking proton pump inhibitors, benzodiazepines, these are things that are eventually going to be causing confusion, they're going to be causing cognitive decline. These are the kind of, I got protocols that can get you off of these things. And of course, just getting you on supplements that can make you feel better and actually go to the root of some of these disease states, and that's what you're looking for. You don't just want to be putting Band-Aids on everything.